more people out there than we have up here. You want to come on up and sit up here? You guys want to come up sit up here also? You want to come on up and sit up here? We'll make it look like we have a full house. Well, I'm going to go ahead and call the meeting to order, even though we don't have a quorum. So, very, very poor planning on the part of the city clerk having this meeting when so many people are away on vacation.
Sorry, Mayor.
That's a good. Yeah, I don't know how it works in your business, but it's always good to be at the top of the food chain because you blame everybody going down the list, regardless of whose fault it is. So, but at least I do it in public. What's that? No, I said, what's Spark? Do they meet? Okay. By the way, we're really casual here, so have fun with your presentation when you come up. So, we're gonna call the meeting to order. Like I say, go ahead and call the roll for those who are here. James.
Absolutely, Mayor Minto. You are first, Mayor Minto.
I'm here.
Sheriff's Department Captain Catro.
Here.
And Mike Aiken.
Present here.
And then for the record, Mayor, there's a number of agencies and people that did contact me just because of scheduling issues that they wouldn't be here. But I know, Linda, at least some of them are watching online.
So one thing that is really great about what we do here is, even though we don't vote on something because we may not have a quorum, all of this is recorded as live TV. So if you get nervous about being on live TV, just remember there's a lot of people that watch this, and they're counting on you to do a really good job.
Have we ever figured out how many people actually watch it? Were we able to get any of that on
We
that?
get an update every once in a while. Do you know?
Not offhand, but I can check with marketing later.
Because, I watch it more on YouTube.
Yeah.
All the stuff is, because your YouTube channel just pops right up and I catch up quick. I like it. Works good.
So, okay, we're going to skip the approval of the minutes, because we have to have a quorum for that. Let's get a quick update on neighborhood watch and crime prevention.
Okay, so our crime prevention.
Yours?
Our crime prevention gal isn't here, so I'll fill in for her a little bit. A couple things I just wanted to highlight. One, again, National Night Out is approaching. That's August 6th. We've collaborated with the city for the city concert that night. Sheriff Kelly Martinez will be in attendance as well. And again, that's just to promote, the police, the community, partnerships, neighborhood camaraderie for that night. So that should be a good night. We'll have a lot of, we'll usually have some of our SWAT stuff out there, bomb arson stuff out there, just a lot of interaction with the cops and our toys. So welcome for that for August 6th. And then moving ahead with one of our children's programs, Rise Above, I wanted to put out that we've locked down a location for that. We're in partnership with our Lakeside substation and the Santee station to bring this event together to the community. It's a 2-month program approximately. It's going to be held at the Lakeside Middle School, 11833 Woodside Avenue. And that will be, it's on every Wednesday for an hour and a half. Starts off with a nice dinner with the kids, the parents, and the sheriff's office. And then we break it up into groups. It's anything from cyberbullying, e-bikes, online safety, drugs, alcohol. There's different topics every week that we cover. We have a portion for the kids, and it's scaled to them, and then we have a portion for the parents as well. Like I said, it all wraps up in about an hour and a half. And we've been doing it all over at North County stations, South County stations, so we're finally bringing it here to East County. It'll be our first one. And those dates are September 9th is our kickoff, and it will go to the end of October, October 28th. So that is, we also have teamed up with, it's still almost completed, with a film company that's doing a documentary in East County. And they've already started filming, and we've been in meetings with them, but obviously the sheriff's office is a part of East County. And we'll be having them ride along with us, and they'll do some filming and documentary of us. We'll be a part of this East County documentary when it comes out.
Sounds good. just for your information, in my last meeting, Assembly Member Chris Ward spoke, and he talked about partnering with a couple other legislators. And there's a bill pending right now regarding e-bikes, one of it. And that bill would require the CHP and school district to do an online class, do classes at the school and then some online classes, and before kids could even get to ride a e-bike. So, and actually it was Lori Davis who partnered with Catherine Blakespear. And I guess they've had a lot of problems up there in South Orange County. And that's one of the places where the mom is being prosecuted because her son killed somebody on his e-bike. So that's going to be pending. And my guess is by September, it'll be signed by the governor. There's just so many controls being put on that right now. So that's one good thing out there, speaking of health. So, and is that it?
That's it.
Okay. No speaker slips on that, right, James?
I currently have no speaker slips at all, Mayor.
Not at all? Wow.
Carl?
You just said something that piqued my interest.
See, I'm paying attention, aren't I? So, well, then let's go ahead and go to our presentation. And this is from the County of San Diego on changes to CalFresh and Medicare. That's HR 1. And Doctor, welcome. Thank you very much for being here.
Let's see. Thank you so much for having me. I really appreciate it. My name is Liz Hernandez. I serve as the interim Deputy Chief Administrative Officer for the Health and Human Services Agency. And we have a couple of our county colleagues here today, as well as Matthew Parr from the Economic Development and Governmental Affairs Office, some team members from Self-Sufficiency, as well as our Regional Community Coordinator, Kelly Ann Rodriguez. So they're here to, just in case you have any special questions, they're here to help as well and answer any questions you may have. So what I'll share today is an overview of what's changing and, more importantly, who is impacted in San Diego County. And I'll specifically go into the city of Santee as well regarding HR1. I'll also walk through what the County of San Diego is doing to help and what resources are available for community members and community leaders in order to respond and mitigate the impacts of HR1. So there's a couple of key points I want to share up front. First, these are some of the biggest federal changes to Medi-Cal and CalFresh in decades. And a top priority is clear, which is consistent messaging. So I really appreciate the opportunity to share today. Second, the county is here to help. For the past year, we've been planning and responding to HR1 with the goal of keeping our community connected to benefits. And third is the importance of customers keeping their contact information updated and responding to our county contacts. While we will do everything we can to remove the barriers and reach people, at the end of the day, our customers need to take action to keep benefits and to get benefits. And lastly, while these changes are immense, most people will be able to keep their benefits. That's why it's really a priority for us to help individuals identify their exemptions and provide resources. So if you take anything from this presentation today, it's that every individual and every family member is unique, and it's incredibly important to work with our county staff to understand the rules and check eligibility. And the last thing we want is for people to assume that they're no longer eligible for assistance. So for some context, CalFresh is California's version of the Supplemental Nutrition Assistance Program, or SNAP. And it provides federally funded food assistance to almost 400,000 people in San Diego County. Almost a third of them are under the age of 18. And this includes about 5,000 residents in the city of Santee, and about half of whom are under the age of 18 or over the age of 65. When we look at Medi-Cal, Medi-Cal is California's Medicaid program and provides health insurance for more than 800,000 people in our county, a third of whom are under the age of 18. and around 300,000 are a part of what is called ACA, or Affordable Care Act, expansion population. And this expansion population includes adults aged 19 to 64 without dependent children who meet certain income limits. And many of HR's changes apply to this expansion population. If we look specifically at the city of Santee, there are about 10,000 residents who are enrolled in Medi-Cal. So what exactly is changing in HR 1? So HR 1 is also known as the Federal One Big Beautiful Bill Act, and it brings changes to CalFresh and Medi-Cal programs over the next several years. These changes won't affect everyone, and so some community members may not experience any changes, while others may face new requirements or limits to their eligibility. At a high level, let's start with CalFresh. You see the green up on the slide here. As of April 1st of this year, some groups of non-citizens become no longer eligible to enroll or continue benefits at their next renewal. And as of June 1st, 2026, there are new work requirements for what we call able-bodied adults without dependents to get or keep CalFresh. On the bottom half in blue, starting in January 2027, there will be work requirements, and Medi-Cal renewals will need to be required twice as often for certain adults. And there is some pending guidance that we're waiting for. We're hearing that this January 1st may be pushed to March 1st, 2027 or later. So there are other changes that HR 1 enacted, and even more changes enacted by last year's state budget. So we believe the changes I described will have the biggest impact to the people the county serves. So we will first look more closely at the CalFresh changes for non-citizens. Prior to April 1st, many non-citizens were eligible to receive CalFresh, including asylees and refugees. With the new rules, only the groups listed on this slide will remain eligible to apply for or renew CalFresh benefits, provided they meet the income requirements as well. This includes U.S. citizens, U.S. nationals, lawful permanent residents, sometimes referred to as green card holders, and others listed on this slide. Listed here are the groups of non-citizens who would no longer be eligible for CalFresh. We estimate that around 13,000 current CalFresh recipients may fall into these categories and lose their food assistance. There's about 150 Santee residents who currently get CalFresh and may be impacted by this change as well. So it's important to know that if someone is a member of one of these groups, it does not mean that their CalFresh benefits automatically ends on April 1st. It means that when their renewal, also called recertification date, is due, their eligibility is going to be reviewed using these new rules. If someone is part of these groups and their immigration status changes, this could make them eligible for CalFresh. For example, if a refugee adjusts their immigration status to lawful permanent resident, they'll be able to keep their CalFresh. So the county is going to continue to work with each person to see if there's been changes to their status. And really our loudest message is this: even if people fall into these categories, it's important to please submit their applications or renewals so that we can review each case individually. For those who do lose their CalFresh, we have another safety net. We refer them to 211 San Diego. 211 has a great website where people can type in their address and see all of the food banks surrounding their place of residence, including church food banks, San Diego food banks. And so we are grateful to our Board of Supervisors who have allocated funding to the San Diego Food Bank and Feeding America as well. So the next CalFresh change is work requirements. These changes went into effect last month on June 1st. To meet the requirement and receive continuous CalFresh benefits, some adults 18 to 64 need to participate in one of the approved activities listed here for at least 20 hours a week or 80 hours a month. This could include job training, community service, volunteer work, or a combination of all four. These rules apply when able-bodied adults are applying or renewing their CalFresh. And like the non-citizen changes, they are not impacting everyone at once. If someone is not able to meet the rules, they can still get 3 months of CalFresh every 3 years. And there are many reasons why the rules would not apply to people, including if they're under the age of 18 or over the age of 64, in a household with a child under the age of 14, physically or mentally unfit for employment, pregnant, they identify as Indian, urban Indian, or Californian Indian. They participate in the Office of Refugee Settlement Training Program at least half-time. Bottom line, the county is going to work with each person who's applying or renewing their benefits to identify any relevant exemptions and explain the rule change. So of our current CalFresh customers, this map shows where the highest numbers of people who will be subject to the CalFresh work requirements and therefore may lose or may be at risk of losing their food assistance. We estimate about 93,000 adults will have to meet the work rules to keep their benefits countywide, and that looks like approximately 1,000 Santee residents. We're aware that about 50% are either meeting work requirements or exempt in some way, and many are already working or have enough volunteer, training, or education hours, which means they can keep their benefits. For people who do not already meet these requirements, resources are available to get those work or training hours that are needed. To recap, the CalFresh changes are now in effect. There are rules for some non-citizens and work requirements for adults. We know all of these eligibility changes can be complicated, so the most important thing to do is for people to keep their contact information updated so they can be notified if these changes apply and continue to submit their referrals. So now we're going to shift to our Medi-Cal changes. And this one's a little bit more complicated because we're still waiting on several decisions from the state government, but we do want to talk about potential impacts to Medi-Cal recipients. So federal changes that impact San Diego County include some that Medi-Cal adults age 19 to 64 who are without dependents will be subject to new work requirements starting January 1st, 2027. And again, we're hearing that that might be pushed to March 1st, 2027. Eligibility will need to be checked twice per year for this group, which is an increase of one per year check that is happening now. Many Medi-Cal adults will be exempt, such as people with disability or caretakers of people with disability, or if you're a parent with children ages 13 and younger. And there are other exemptions, as these rules won't apply to everyone. For those who do need to meet the rules, will generally need to work, volunteer, again, attend school or job training, or a combination of these for at least 80 hours a month. As with CalFresh changes, every situation is unique. So while the changes to Medi-Cal are significant, most people will continue to qualify for benefits. Each person's case, again, will be evaluated individually by the county. For those that will be affected by these changes, the county estimates that approximately 314,000 county residents who have Medi-Cal now will now be subject to new work requirements next year. We also estimate about 95,000 individuals might lose their Medi-Cal health insurance because they're either unable to work or show that they're able to be exempt from new work requirements, or they're unable to prove their work, volunteer, education hours meet that 20 hours a week that I mentioned earlier. And beyond this 95,000, we estimate that an additional 75,000 people could lose their full scope Medi-Cal coverage due to their immigration status, and that they may only be able to access emergency Medi-Cal only. Although these are just estimates, we anticipate that some county residents may lose their Medi-Cal health insurance, so we'll need to take advantage of other programs. On this map, it might be a bit hard to see, but it gives you a sense of the zip codes with the highest number of people likely to be subject to these new requirements. These are the zip codes with the thicker borders that you see on the screen and zip codes listed on the screen. The colors represent levels of vulnerability defined by the state. You can see zip codes in the south and central regions of the county will have the highest number of residents who will need to meet work requirements. And again, in the city of Santee, approximately 3,400 Santee residents will potentially be subject to Medi-Cal work requirements. So what is the county doing? As I mentioned before, we're here to help. The County of San Diego is taking a coordinated outreach approach and making sure we're reaching the populations that may be impacted by these changes. Our goal is to make sure no one loses their benefits. because they did not know of the changes, or to support those that do lose benefits by informing them of other available resources. We have been and continue to send texts, automated calls, mail, and making sure information is widely available. We're also looking at ourselves and our systems, how we can improve to make service easier and faster for residents. And the county is coordinating with the state, other counties, community-based organizations to support and implement shared resources. Most importantly, we're leveraging partnerships to help people stay informed about the changes. And so there's a few key decisions and opportunities coming up that I want to make sure that you're aware of. Number one, the county has adopted our budget as of last month, and part of the budget this year included an increase in staffing for eligibility workers at the county to make sure we can help residents navigate these changes. The next two are initiatives directed by the Board of Supervisors that are intended to expand the healthcare and food access for people who lose their benefits. The first one is called the Safety Net Bridge Pilot, and the next one is called County Medical Services. We're in the process of designing and redesigning those safety net backup healthcare programs to be considered by the board later this year. So while these rules are very, very complex, there's also very simple ways that customers and leaders can take action as well. What can CalFresh and Medi-Cal recipients do next? If those who are at home listening to this, the most important takeaway is that if you're impacted by any of these changes, you're going to be contacted by the county and informed of your intake interview and your next recertification date. So it is incredibly important to keep your contact information up to date so you receive any notices and information. You can also visit your online Benefits Cal account to make sure your email, phone number, and addresses are all up to date, and also check your renewal recertification month. And then for more support, we have lots of family resource centers, or you can call our Access customer service line that can easily provide support as well. The County of San Diego, this is really exciting, is partnering with 211 San Diego to provide a one-stop shop for connections to resources for work programs, job training, education, volunteer programs to help individuals meet the new requirements for CalFresh and Medi-Cal. And so we're calling this the Work Ready Hub. It is a one-stop shop for those that are looking for 20 hours a week of work or volunteer or training. People can just click on the Work Ready Hub or just go to that QR code and get access and get started and get connected. We're also asking for organizations out there. This is a link for you to add your work or volunteer resources to the Work Ready Hub that I just mentioned. So that our clients can go to one place for all of these different types of resources. And if your organization supports people that may be impacted by these changes, here are some important links. This presentation and these links are available on our CalFresh Medi-Cal Changes Toolkit, listed at the bottom of this blue bar. The Changes webpage is updated as we learn more information. So if you need enrollment support for your clients, if you see an organization is a good fit for the Access CBO line, which is a line available for community-based organizations to call and speak to a live agent to get general information. Organizations can also request a Live While on Wheels with self-sufficiency staff to attend events so that we can support them with all of these changes. If you have job or volunteer opportunities, again, we have our Work Ready Hub, and people can also sign up for e-newsletter updates to include general resources and events across San Diego County. And you can also request a presentation to come to your organization or your event, just like this one. These tools are templates being created to support in really supporting the community. And we continue to update this toolkit frequently. And with that, I just want to say thank you for your time and happy to answer any questions.
You have anybody else from your crew that's going to speak?
No, I think it's just me.
Well, good work, team. You did a great job supporting.
Thank you, Mayor.
You know, if I can go first here, it's a lot of work obviously went into this. We get questions from time to time, what do I do? And a lot of times it doesn't trickle down to us about how to give advice or where to go find advice. go to the county, they'll talk to you. Well, that doesn't really give them very good direction. They may have to sit there for a while and kind of figure out the maze of web pages and things of that nature. So I, for one, appreciate you bringing this to us and making this presentation. I do have to say this, though, in my crazy little brain that I have, it's not brand new. I think some of this was introduced back in about 1941 by a guy named Franklin Delano Roosevelt. And he was the new guy that said, we got to fix the fact that nobody's working, people are on the dole, and the government can't afford to continue with that. And I think that's what happened when Reagan became the governor of California and said, too many people are on welfare. So they created workfare. And this is very similar to that. Now here we are again. So some of the questions are, why are we not remembering the past? Why are we coming around again? So what I also heard you say is that it's not just the government's job to make this happen. Mm-hmm. It is the responsibility of the people who are involved in this to also make it happen. If we give you assistance, you should be able to work towards getting out of that assistance. Mm-hmm. Kind of reminds me of that movie, The Cinderella Man, where Russell Crowe plays the boxer, and he goes and he borrows money from the government, and when he made it big, he gave the money back. He felt that his was his obligation to help those who also need the money. He didn't need it anymore. So I guess that's the message that I take away from this, is that we're all in it together. Mm-hmm. If you can work, work. And besides, there's a little bit of pride in work these days. Not as much as it used to be, it seems like, but maybe if we put more people back to work, it'll happen again. So one of the questions I did have is when I read in here about, let me find my note, I'm sorry. The federal changes to Medi-Cal has said adults 19 to 64 years old without dependents. And I mean, if you're 64-year-old and you have dependents at home, man, I'll tell you what, you started way late. But is 64 that magic number because at 65, Medicare kicks in for majority of people?
That's my understanding, but I'll just, yes. Yes.
So I read into it right.
Yes.
Good. So I like that. And for those who are watching that are approaching that age 65 and are wondering, gee, should I go out there and, start my process? The answer is yes. I'm 68 years old. I entered that program 4 years ago. And it actually, even though you might have regular medical insurance, this is something that can really help you. Because, the first number of years of our lives, those are the learning years, right? Mm-hmm. And then we go to work out there, and for about the next 40 years, those are earning years. And if you're financially strapped, those will, after 60 years old or 65 years old, they become what I call the yearning years, the yearning for the life I used to have, because maybe you didn't make the best decisions. And if the county is willing to do all this work to help people be successful, to get assistance, then you know what? We should be willing to make sure that we pass that information on to others and help those who need resources. Captain, we have a number of people that live on our streets that frequent our parking lots who are resource deprived, I think. So I think this is a great way for us. I know that the deputies are out there. They carry their little card with resources. 211 is a big one. And I really, really like the fact that you have all these additional community and food resources. Many small cities, like we have a big, actually a pretty good sized food bank here in Santee. We feed a lot of people. And we know every year when we get the request for money that that number seems to go up. Mm-hmm. We're hoping for it to go down, but hope is sometimes a fleeting part of the faith we have in our communities and businesses. So so I didn't really have a lot of questions for you, but I wanted to thank you for being here and tell you what I thought about some of what I heard. And so anybody else have any questions up here? Michael or Chris?
No, thank you.
Yeah, Carl, any questions? Have any questions? Come on up. Well, come on up to the microphone because we need you to get, because this is a record and your voice on the microphone is a record. So thank you.
My name is Victor. Actually, my biggest question is really how to distribute to the people in need. I heard it several times, you have to have the resources. And you mentioned people need to know about the information, but what is the real way that we're getting the information to them, just besides them, like, hey, my benefits are expiring and I didn't know about that. So I guess that's my question.
So I guess the best question is who's advocating for
Correct.
those folks? Yeah.
Yes.
So our self-sufficiency team has done a phenomenal job in terms of connecting with those folks who are going to be impacted by these changes.
Okay.
We're texting them profusely.
Right.
We're calling them. We're giving them, sending out mailers as well. And so we're technically hounding them.
Gotcha.
So we definitely want to push it out. And then for everyone else, we have lots of social media. We've done press conference. We've done outs, different media components. We've done hundreds and hundreds of community organizations. Happy to go to any other organizations to continue to push out this message because it's a very important one.
Okay, thanks.
Thank you.
So, James, when we start putting this together to go up on our website for replay, perhaps we can include some of this information, some of the QR codes, things of that nature. So that'll be another great way because, believe it or not, we do have a pretty good following here, and we have a lot of different organizations, especially county organizations, because anytime people want to get the word, we help them with that, whether it's this type of information or how to take care of your dogs and cats and things of that nature. So this is a great opportunity for you.
I just wanted to say a big thank you. I'm sorry, I heard someone else.
Go for it.
No, just a big thank you. We're big believers at the county regarding the power of collective impact and working together in order to support our communities. And so just a big thank you. We know that, food is health. We know access to healthcare is incredibly important. And if people don't have that, then there's impact on law enforcement, there's impact on emergency departments, impact on our hospitals, and there is a huge ripple effect. So if we can be preventive and get ahead of it and work together, that's going to be a win-win for everyone. Thank you.
Very much, Doctor.
And
Thanks,
Mayor,
team.
I did want to let you know, I know like when Rebecca was on the committee with CASA, she was very interested in this presentation. Kate did reach out to me today saying that she would be unable to attend, but their organization would definitely benefit from something like this, and I'm going to be sharing the presentation with them so that way they all have it for their information.
And can you also send them Elizabeth's information?
Absolutely.
That'd probably be someplace that you want to, I mean, we just to pat ourselves on the back, I guess. We in Santee with this committee, we actually have quite a few community-based organizations that are part of it. And the reason why is because we know that government can't be everything to everybody, and that there are groups out there that specialize in helping others. And so they're part of us. And so you're more than welcome to get their information. Just contact Joe. Have one of your team members contact James, and we'll give you anything you need that we have. You're welcome. Thanks a lot. All right. Item number 5, community core values. I think the only update we have on that is when we had our Santee salutes this year, we had a really, really great time. Sheriff, you did a great job out there. I've heard from several people how nice it was. The fact that your deputies went out there and just mingled with people and out there, like big, bad, tough, legalistic style, because we know that from years ago that doesn't work. And so I appreciate that. Our firefighters did the same thing. They went out there and they kind of had a good time mixed. And I think I said this at one of our council meetings. The days when our law enforcement officers and our firefighters are just out hanging out and not running with lights and sirens someplace, that's a good day for the people in our community. And when they have to run with lights and sirens, it's a bad day for somebody. So we like to see those really good days for our law enforcement officers and our firefighters. And, we had a lot of discussion and comments that I heard also about things, about how well balanced our community is, and people getting along. And I think that goes right back to the fact that we do have some very good core values for this city. It's not the city of 50 years ago. And so that's something that we can all be proud of. You guys have anything to say regarding that at all? I know you're not putting in speaker slips, but still, I'm going to be as, casual as possible and give you an opportunity to speak. So if you want to speak, come on up now or, okay. Then let's go to item number 6, was communication from the committee. Any of you have anything?
I have nothing to speak, sir.
I will say, at the 4th of July, it was a competition. If I did see a kid with a firefighter sticker, I made sure to put a deputy sheriff sticker on that kid as well. So, but no, nothing to add.
Well, the firefighters are coming to help people, and it's not always recognized when the other guy with the badges is coming to help them also. It's usually more of a negative. So, but you guys did a good job of, promoting yourselves. Anything, Elizabeth? Okay, James.
I do indeed. Ivy from the Institute of Public Strategies did want me to let everyone know that the Institute will be out at the Santee Summer Concerts this summer at the on the 16th, the 23rd of July, and then on August 13th. And they will have a table set up for substance abuse prevention resources. So,
Excellent. Thank you. All right. Any comments at all? Okay. Well, in that case, wow, we're getting done really early here. I'm going to go ahead and adjourn the meeting.